Hello and welcome to our podcast regarding the UK Research Priority Setting Partnership for Childhood-onset Neurological Conditions, recently published in Developmental Medicine and Child Neurology. My name is Jill Cadwgan. I'm a consultant paediatrician in neurodisability at the Evelyn London Children's Hospital, and I was involved as a steering committee member, the information team lead on the study. The study was led by Professor Helen Cross, the consultant paediatric neurologist, and Professor Ming Lim, consultant paediatric neurologist. The James Lint Alliance methodology is a well-established methodology for setting research priorities and engages all stakeholders in the priority setting process. This includes young people, patients, and their carers who have lived experience of childhood neurological conditions. For that reason, I'd like to introduce Rhys Inward, who is a young person with a childhood-onset neurological condition who was engaged in the study from onset to completion as a young person representative. He is currently a PhD student studying at Oxford University. Thank you.
Thank you for that introduction, Jill. Today, we want to talk to you about a recent paper, a UK Research Priority Setting Partnership, which brings together patient, carers and clinicians jointly to identify priorities for research into childhood neurological conditions. Currently, around 1% of individuals will have a childhood neurological condition. These are highly heterogeneous and can include both common conditions such as epilepsy and cerebral palsy, as well as some rarer ones. These conditions are associated with significant medical comorbidities and can lead to life-altering disabilities. Over the past few decades, we have gained a greater understanding of the underlying causes and mechanisms of these conditions. However, further research into both pharmaceutical and non-pharmaceutical interventions is required, and research priorities must be set considering the limited amount of funding available. To establish these research priorities, we conducted a priority setting partnership, which brings together patient, carers and clinicians to agree on the most important unanswered questions in interventions for childhood neurological conditions. By creating these research priorities collaboratively, we aim to highlight important knowledge gaps and identify future research priorities that can help direct research with the aim of improving the health and well-being of children and young people with neurological conditions. To set these research priorities, we conducted 2 surveys aimed at a range of individuals with a stake into childhood neurological conditions. The first survey was used to identify and order into themes, uncertainty and questions our community had regarding the interventions, and we removed and identified any that were out of scope for our priority setting partnership. In the second survey, after refining and condensing the questions into a long list, our community ranked these questions by importance. The top ranked questions were then discussed at an in-person workshop with various stakeholders to reach consensus on what the top 10 priorities should be. And over 2,000 people participated across these activities. The top 10 research priorities encompass a diverse range of research needs. Some are specific to certain conditions, such as priority number 8. Are medicines effective in the management of PANS and PANDAS? Others are broader, addressing issues that affect most, if not all, childhood neurological conditions. Examples include priority number 2, interventions for sleep and childhood neurological diseases, and priority number 3, managing emotional well-being in childhood neurological disease. Establishing these research priorities is vital due to the challenges in designing studies for this population. The complexities of childhood neurological conditions and the broad spectrum of interventions required make it difficult to focus research efforts effectively. By having clear set out research priorities, we can better support funding applications and ensure that most critical questions are addressed. In addition, researchers and clinicians looking to take on some of these research themes will be supported by the BPNA research group who work with national networks and the NIHR to facilitate collaboration and networking for these applications. Moreover, it's important to note that previous priority setting partnerships, such as the Childhood Disability PSP, has successfully led to funding being granted to 12 projects as a direct result of the priorities it has set out. This demonstrates the tangible impact that well-defined research priorities can have in directing and securing funding for research. Just to round everything up, by engaging with a wide range of stakeholders, we've identified the most pressing research questions in the field of childhood neurological conditions. These priorities will guide future research efforts aiming to improve the health and well-being of children and young people affected by these conditions. Thank you for listening, and please get in touch if you have any additional questions.